this in the lumbar spine, okay, right where the curve should be, right? So the main part of the cuff is behind the belly button of my in my back, okay? I'm gonna lie here in normal posture. My feet are on the floor. The closer my feet are to my butt, the easier the exercise is. The further away, the harder it is, okay? I'm gonna tighten the gauge, and I'm gonna pump this up to 40 millimeters of mercury. Okay, so I've got the needle at 40, okay? Now what I'm gonna do is I'm gonna start by doing a transverse abdominus contraction. So I'm gonna draw my navel in, okay? Then I'm gonna flatten out my back to get this till about 70. Okay. Now for you, these numbers might be a little different after we check this, okay? So now, 70 is where I want to keep the needle the entire time, okay? If the needle fluctuates, what that tells me is my spine or my pelvis is moving, okay? So if the needle jumps up in pressure, I'm flattening too much, meaning I'm doing a posterior tilt too much. If the needle drops, I'm going into an anterior tilt. Okay? So right now I'm going to put it at 70 and I'm going to keep it there. I'm also going to keep my transverse abdominus on. Okay? So as I keep it there, I'm going to go, okay, it looks pretty stable. What I'm now going to do is try marching. Right? So I'm going to take my left leg and I'm going to raise it up and I'm going to exhale. All the way to where my knee goes directly over my hip. And I'm inhaling, set it down. And then I switch. So, when you talk about Paul's Movement That Matter book, right, what you learn to do is you take all movement patterns and you see what is their primal standard, how well can they do them. This is taking the gait pattern and descending it, making it way easier. Okay? So what essentially you're learning to do is bring your legs, move your legs around with keeping your lumbar spine stable. So if I do it without this, I don't really know what the hell's going on, right? Now there's people or PTs or someone that says just do it, you know, flatten your back out, right? Don't let any space occur. Well, that's not really right, because that's teaching you how to have a flat back, right? Remember, everything you do in the gym or in exercise, you're teaching your brain. That's a movement pattern.
Right.
Okay? So if you're telling yourself to do this with a flat back, you're essentially telling yourself to cycle and walk with a flat back. Okay? So the cuff is going to represent the neutral for you.
Okay.
Okay? The rule is going to be you start with level 1 until you can perform it for 2 minutes straight. Okay? Here's level 1. Or actually, I think in Paul's world they call this 2, lower abdominal number 2. To make it harder, like if you're doing this and you go, I can do it for 2 minutes, you straighten the knees more, right? Okay? So once you're to this point and it gets easy, you go to version 2B. 2B is where we start up here, right? Just like that. And to make this harder, you would straighten the leg out further, right? When you can do 2 minutes, you go even further. Look, now I'm going here. Both legs. Because remember, if I'm doing a lower abdominal strength test, normal is being able to go all the way down, tap my heels, come all the way back up without any variation in my lumbar spine. So basically, this version is essentially being able to pass the lower abdominal strength test and being able to stabilize the weight of your legs in your midsection. Okay? So let's practice.